So thank you so much for joining us today for our policy and advocacy information session. We're so glad you're here. And just as a reminder, for those of you who might not know, this content today is the same content that we shared at a Tuesday policy info session. So if you want to get it a second time, that's great. Welcome, but if you already attended, you're also welcome to move on with your afternoon if you think that you got all the content. We're going to slow it down this time. We've asked Alicia and Courtney to kind of take their time because we know we moved really quick. So you might learn something new today just by that alone. So we're going to ask you to stay muted, but we are taking questions and comments via the chat feature, and we're going to try and answer those as we go, either in the chat or afterwards. So the whole goal of today is for you to learn more about the blueprint for Kentucky's children policies. So we're hopeful this is a helpful thing for you to prep you when you talk to legislators. So before we move any further, I just want to give us an opportunity to connect to one another and learn a little bit about you and who's joining us today. So we're going to go through a few poll questions. And so there should be a slide coming up, and you can see that link in the chat. If you click that link at mentee.com, or you can go to mentee.com and use the code you see there. Oh, look at that. People are already using it. You guys might be familiar with Mentee already. So please answer, how many children's advocacy weeks or days have you attended in the past? We've got a good mix going so far. Looks kind of evenly tied between, oh, now the newbies are taking over. I see there's 4 newbies, 2 that have come to 1 or 2, and 3 that have attended at least 3. Oh, the newbies are definitely taking over. Welcome, a special welcome to those of you who are here for the first time. That's awesome. Thanks to all of you who have been consistent in joining us so many times over the years. And we're glad that all of you are here today and this week. Okay, let's move on to the next question. Finish this sentence. Every Kentucky kid deserves what? Please fill in the blank. I think you can use that same link in the chat. It should populate a new question for you. Every Kentucky kid deserves to have the best opportunities, an education and nurturing community, safe and happy childhood, to be loved, absolutely. What they need, basic needs. It's as simple as that, right? Safety, love, and respect. Yep. Every Kentucky kid needs to be well fed, have quality health care, and a safe environment to live and go to school in. Absolutely. Great. Yeah, I know. I think of that when I think of my own kids, but every single kid in our state. That's really the goal. Thanks, y'all. And emotional needs as well, physical and emotional. It's not just beyond physical needs, but we know so much these days in terms of the mental health is incredibly important as well. Great, thank you. Let's move to the next question and final one. So what brought you here today? Please finish the sentence. I speak up for Kentucky kids and families because. Who's inspired you to be here, or what? I'll give you a moment. Mm. Two of us, because we care about them. They're our future. I'll give you all a few more seconds just to build on that and think about, why are you here today? Why do you speak up for Kentucky kids and families? Their voices need to be heard. So I see a comment from someone: I survived a tough childhood and I never want to see a child's need go unfulfilled. That's super inspiring, to use your own experience and want to be part of the change to make sure that others who come after you don't have to go through the same tough challenges that thankfully you were resilient and made it, and we want to support others as they go through their childhoods. There's no second chances there. We all have one childhood. So thank you all so much for taking a moment to reflect on all of those great reasons that you're here today. So now we'll transition into kind of the content piece of today. The purpose of Children's Advocacy Week, as you all know, is to build support for policies that are good for kids. And because we hope that you will be advocating and speaking with your legislators beyond this week, we're going to share the Blueprint for Kentucky's Children Policy Priorities with you today and point out the specific policies that already have bills moving or bills we expect to move. So you can find all of this information on the Kentucky Youth Advocates Bill Tracker, which will link in the comments, a link to that tracker. There it is. And also, if you have any questions, please put those in the chat so that we can either answer them now or follow up with you later. We want to make sure that you get what you need out of this session, and contact us. We want to make sure you're prepared and ready when you have those wonderful conversations with your legislator. So I get to invite my two wonderful colleagues, Courtney Downs and Alicia Watley. They're going to give you an overview of the blueprint and tell you all the meat of what's in it and how you can talk about it. So I think Kelsey's going to pull up some slides for us, and I'm going to turn it over to Alicia first.
Thanks, Patricia. So like she said, my name's Alicia Watley. So thanks everyone for joining and just being here to learn more about the blueprint. This afternoon, we're really going to be going through quite a bit of policy information. It can be a lot. So we are dividing it into kind of two different sections. So first, we're going to talk through our priorities on the blueprint that have not yet become bills. So our policy and budget items that are either not in the budget or are not a bill yet. And then after we do that, we will share the policies that are actively moving, the ones that already have a bill number that you can kind of follow along with right now. So just because I know we do have a few newbies on the call, as we went over a little bit earlier, that maybe this is one of your first times engaging with us. We want to just do a quick overview of what the blueprint is for everyone. So it is a coalition of nonprofit, public and private organizations, and it really stands on three pillars, and that is that thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. And the Commonwealth has really been working to overcome the impacts of both the COVID-19 pandemic and also addressing systemic racism. The blueprint speaks with a common voice to create a brighter future for all Kentucky kids and their families. So now I'm going to go through a few of our priorities. And like I said, these do not yet have a bill number associated with them, but we just wanted to kind of give you an idea of what these policies are and what we're looking for as they get filed later in the session. This first one is to allow city and county governments the option to regulate the use, display, sale, and distribution of tobacco products. And that does include e-cigarettes. And this is really an effort to curb tobacco use among our youth population and prevent our youngest Kentuckians from becoming addicted to nicotine. This priority would remove a current state law, and it would allow local cities and counties to make decisions that are best for their communities if they choose to. So it does not create any new state laws, and it also doesn't create any mandates on the local level on what they have to do. It really just gives them the option to look at what's best for their community and what they would like to do to curb tobacco use in their area. A couple examples that we see of how this can really work well for curbing tobacco use among youth is to limit the advertising of nicotine products in storefronts or at point of sale locations. They can also do things like restricting how close tobacco products can be sold to a school or a park to just kind of get those products away from areas where we know that kids are spending a lot of their time. And you can learn more about this priority on the Next campaign. So we are running that this year as kind of part of our efforts towards advocating for this. It's just a campaign with a couple of our partners, and we have a webpage on that. We also have an infographic that you can kind of share with people to talk about this issue and why it's so important. And we also are excited that we do have a legislative champion, which is Senator Paul Hornback, who is on board with this campaign, and we're hoping to see a bill filed very soon on this. The next one I want to talk about is creating a paid family leave infrastructure. And this is so that parents can access up to 12 weeks of paid leave after the birth or adoption of a child. So this priority is obviously good for kids and their families. It promotes greater bonding between parents and their new children. It supports income stability for families, and it's also linked to better developmental outcomes for children. So really there's a lot of positive outcomes that are associated with this. And we know that this is really important because up to 60% of working Kentuckians really don't have access to paid or unpaid leave at this time. And so we know that this is a priority for many Kentuckians. The next one I'm going to talk about here is prohibiting mental health professionals from engaging in sexual orientation or gender identity change efforts with a minor. And so that is banning conversion therapy. And this issue is really so important for our LGBTQ youth in order to protect their mental health. So as we know, youth who have undergone conversion therapy are more than twice as likely to attempt suicide than those who have not. So this is on our priority list to ensure that all youth across the Commonwealth can grow up in a safe and supportive environment. Also on this slide, you will see allowing up to 15 minutes of school instruction time to be used for children to eat breakfast in the classroom. So right now, we know that over 6 in 10 Kentucky students are accessing the school breakfast meal program. So there's a lot of kids that are missing out on those meals. And this can be due to a lot of reasons. There's various barriers such as arriving late or just stigma that really keep them from accessing that healthy meal in the morning that can be so important to help them learn throughout the day. So we want to see that more kids are accessing breakfast at school, and that can also help with improved test scores and reducing absenteeism. And we also know that this could help address the ongoing issue of food insecurity that we have seen across the state since the COVID-19 pandemic. It's become way more apparent as well. So this is just a way to, the meals are already available for students, but we want to just get more creative in how we're offering it outside of just cafeteria time before school starts. Now I'm going to pass it over to Courtney to talk about a couple more priorities.
Great, thank you. So let's start by talking about parental incarceration. So for several years, Kentucky has been in the top 5 for parental incarceration. So this year, we want to replicate the primary caregiver bill that was passed a couple of years ago in Tennessee. And basically, this would expand judicial discretion and also the options that judges have for community-based sentencing when the defendant is a primary caregiver to a dependent child. And the options for a community-based sentence can range from mental health counseling or substance use treatment to job placement and financial literacy courses. But the point ultimately is just to find new and potentially more effective ways to address the root causes of certain behavior while still promoting family unification. The next one is a juvenile justice bill. And this one is seeking to establish a minimum age of at least 12 years old that a child can have a case heard in court. So right now, Kentucky is one of the few states that does not have an established threshold for when a child can be prosecuted, meaning that kids as young as 7 or 8 can and actually have been over the past few years charged or brought before a judge. So one of the things that we know is that it is really easy to get into the juvenile justice system, and it is much more difficult to get out of it. So this would promote age-appropriate, community-based responses that address the root cause of the problem instead of relying so heavily on detention. And then finally, the next two are critical child welfare policies that close the loopholes in reporting disclosures or suspicions of child maltreatment. So the first one is we want to eliminate the chain of command reporting policies that exist within public and private agencies that prevent reports to the proper authorities from being made. So in other words, let's say a professional receives a disclosure of abuse and their organizational policy states that they have to report it to their immediate supervisor instead of CPS or another reporting agency. So what we want is to just make sure that, regardless of internal policies, the people who receive the disclosures are reporting them, I should say, to the proper authorities in addition to any type of internal policies that exist. And then the other one is making sure that any disclosures or suspicion of child maltreatment that's perpetrated by an employee of a reporting agency is reported to an external agency as well. So another way of saying that is if an abuse or neglect disclosure is made against a CPS employee, let's say, then they would have to notify law enforcement or the county attorney in addition to any type of reporting that would happen within the CPS office. And finally, the last one is we want to make a small change to the current statute around the time frame for coroners to notify the appropriate authorities of the death of a child under the age of 18. So currently the statute just says that the coroner should notify these entities as soon as practicable, and we want to change it to immediately and then define immediate as within 24 to 48 hours. And this is something that's really important because the more time that passes without notifying these authorities, the less likely it is that any evidence can be available or collected by investigators or others. So I will now hand it back over to Alicia.
Thanks. So I'm going to now mention just a few of our budget priorities that we have not yet seen included in the House budget proposal or in the governor's budget. And we'll get into those a little bit more when we talk about bills that have already been filed. But this first one is to ensure investments in Medicaid and Kinship. And this is really, obviously we want these programs funded, but we also want to be prioritizing closing the remaining gap in health coverage for Latinx children. So we saw in our recent Kids Count data book that there is a disparity in health coverage among Latinx children across the state. So in order to close that gap and make sure that we have those kids covered by a health insurance plan, we're looking for dedicated dollars to be included in the state budget. And that's going to be for things like education, outreach, and support to prioritize enrollment for that Latinx youth population. The second one here is to boost investments in tobacco use prevention and cessation programming. And these are programs that help those who would like to stop using tobacco products quit or prevent somebody from starting to use to begin with. So for the last few years, we have seen the funding for these programs being cut. And this leads to a reduction in the number of programs really that are being offered across the state. So unfortunately, they're not able to support those who want to quit using tobacco products. So in order to support youth, pregnant women, and really all Kentuckians who are trying to quit, we do want to see an increase in funding included in the state budget this year. And then another one I'll mention is we want to make sure that we're protecting the current funding for safety net programs. So these are things like KTAP, SNAP, and WIC. We also want to ensure that these programs are not modified in any way that would prevent children from receiving any needed services. So we know that in Kentucky, over 1 in 5 children live in poverty and 18% live in a food insecure household. So safety net programs really play a critical role in making sure that families who are struggling to make ends meet can put food on the table, cover their basic family needs, and really access other supports and services that they might need to thrive. And I will turn it back to Courtney for a couple more budget items.
Thank you. So the first one I want to focus on is childcare. I think it's important to point out that 40% of working age Kentuckians cited lack of childcare as a reason for not working this year or last year. And then also, half of all communities in the state are childcare deserts, which means that families have limited or no access to childcare. So we want to prioritize building an infrastructure that improves access to affordable, high quality care so that parents can work and children can thrive and our local economies can grow. Next, we want to expand investments for child abuse forensic services, and there are multiple asks here. So the first one, we want to ensure that the child advocacy centers and also the rape crisis centers who provide important medical and clinical services to children who have experienced sexual abuse or assault have the funding they need to provide those services wherever they're needed. Secondly, we want to include the child abuse pediatricians and their teams who work out of the pediatric departments at U of L and UK. They are equipped to provide services to victims of child sexual abuse and assault, but they also have extensive training and expertise on recognizing the signs of physical abuse, especially in young children who are unable to really verbalize what happened. And obviously they have the training necessary to properly treat any type of physical injuries that they have. So when we think about the high rates of maltreatment that we see in Kentucky, it's critical that they receive funding so that they can continue to provide these services and also to expand their clinics so that they can more easily reach children all across the state. And finally, we want to increase the reimbursement rate for pediatric sexual abuse forensic examinations. This rate has not been adjusted in decades, so they need to see an increase so that there aren't any barriers to providing those critical medical exams. And now I'm going to hand it back over to Alicia, who's going to start talking about what's happening now in the General Assembly.
Yeah, thanks, Courtney. So I'm going to pause just for one moment before we move into this next section to make sure that there were not any questions about all the priorities that we just mentioned. I know we kind of went over a lot right there. Feel free to use the chat feature if you have any questions. I'm not seeing any so far. Feel free to continue to put them in there if you have any while we're going through. So I'm going to talk now about the what's currently happening in the General Assembly, because we are already in the middle of the legislative session. So there are going to be a few things that you'll see on these slides. You'll see if there's a bill filed, we have the number on there, and then you might see who is sponsoring it as well. So this first one is to increase Medicaid funding to support health coverage for mothers up to 12 months postpartum. So right now in Kentucky, many mothers will lose their coverage just 30 days after they welcome a new baby. And we know that postpartum really is a vulnerable time for new mothers and their baby. And this is especially true for women on Medicaid. And so despite the increased risk of postpartum death and illness, up to half of women do not receive routine care after birth. So we know that this is a concern, and we really would like to see this coverage extended for the Medicaid population up to 12 months postpartum. So we have seen a bill filed to allow for that. You'll see that on the screen. It's House Bill 174, and it does allow for the coverage to extend 12 months postpartum. I'm going to make a little note here that this is related to Medicaid coverage, which means it is tied into our state budget. So although this bill has been filed to allow for that coverage to extend, we have not yet seen dedicated funding identified in either the House or the governor's budget to really cover those additional months. So in addition to this change, we would need to see more money allocated specifically in the state budget by the end of the session when they have a finalized budget to make sure that we can account for all the extra months that we're covering these women. The next one here is to increase funding for family resource and youth service centers, or FRISCs. And so they work with families to remove barriers to student learning. As we all know, Friskies really provide a critical service to students and their families to ensure that all students are ready to learn when they step into the classroom. So we're happy to see that there is an increase in the funding for Friskies in both the House and the governor's budget. So here you will see it's listed as House Bill 1 and House Bill 285. So for everyone on the call, House Bill 1 is actually the House's budget proposal. So you can go and see that bill online. It should be available on the LRC. And if you want to follow along on our bill tracker, most bills are on there. And then also House Bill 285 is the governor's budget proposal. So you'll see that those are two different bills that have been filed, and you can kind of look at the differences between them on where they're putting their money to prioritize different programs. House Bill 1 is actually passed committee today, so it is moving very quickly. So we're seeing a lot of movement there. So like I said, they both did increase the funding for Friskies, which is really exciting. And then also the next one here you'll see is to continue funding for full day kindergarten, which is really just an investment in early education. And we know that full day kindergarten offers so many benefits to our Kentucky students, which include narrowing the achievement gaps and promoting literacy development. Also, it is a way to ensure access to nutritional breakfast and lunch for students. So again, it was included in both the House and Governor budget proposals. So we're really excited to see that. Another commonality between the two current budget proposals is an increase in the per pupil funding, the SEEK funding, which supports public schools and helping all kids learn. And then the last one I have listed here is increasing funding for school-based health providers and access to school-based behavioral health services. So thanks to the expanded care services policy, which was enacted in 2019 in Kentucky, school districts can now bill Medicaid for health services that are provided to eligible students within the school building, or actually in virtual school settings as well. So during this time of heightened social and emotional needs, schools, healthcare providers, and other entities that work with children and families really need to be elevating the efforts to identify signs of stress, anxiety, depression, things like that among our students. So school districts could really use this funding to connect students to physical, behavioral health screenings, counseling, even like immunizations and preventive dental care. It's a wide array of things that we could provide to kids in schools if we had the funding stream to support it. So we do see that the governor's budget proposal included an increase in funding for these services. Unfortunately, the House budget proposal did not specifically include an increase here. So we're hoping that that will be additionally added before the finalized budget is done at the end of session. So that is just something that we're looking for to still be added there. And then I'm going to pass it back to Courtney for just a couple more items.
All right, thank you. So I will start with House Bill 83, which ensures that victims of domestic violence, dating violence, sexual assault, and stalking are not prohibited from receiving unemployment benefits if their reason for not working is directly related to the abuse, the assault, or the stalking. This bill also has a training requirement for anyone who processes these claims, and a report has to be submitted to the legislature on the number of claims that are processed annually. So this is sponsored by Representatives Kulkarni and Heverin, and it has not yet been assigned to a committee, but again, it is House Bill 83. And then the next two items that I want to go over are both included in the House and the governor's budget. So the first one is protecting funding for HANDS, Home Visiting Program. And HANDS provides free and voluntary services for new and expectant parents who are seeking support and education throughout their pregnancy and for the first 2 years of their baby's life. It's also important to note that this is an evidence-based program and is proven to reduce instances of child maltreatment. So it is a critical program that we need to continue to fund. And the second will bolster investments in the DCBS workforce to hire more frontline workers. And again, this is another critical needed budget allotment because these employees provide critical services for some of the most vulnerable children who are in our state. So I know that that is, again, a lot of information. If you all have questions, please let us know, but I will pass it over to Patricia.
Thank you all. So yes, that was a lot of information. So I'm going to just pause. We'll take about 30 seconds to see if there's any more questions in the chat. And please don't feel shy, because the chances are that if you have a question, others here have it as well. So while we're waiting, I'm going to go ahead and give a quick shout out to the many Children's Advocacy Week sponsors that you can see displayed here. There's the logos, and there's a full list on our website or in the app. But I'm also just going to give it 5 more seconds to see if there are any questions. Okay, we got one from Sherry. How will the funding budget be divided? So I'm wondering, I think what I'm going to see if this is hitting what you're asking. So currently with the budget, we have the House budget is now passing. It's up for a vote in the House floor, and then the Senate's going to take their stab at allocating the budget. Oh, okay, within the schools, that helps. With this, so that's through the SEEK formula, which I am not an expert in. Alicia or Courtney, do either of you want to tackle trying to share that?
I would be happy to find the answer and circle back because I don't want to misspeak right now, sorry.
Yeah, so essentially the SEEK formula is the process for how they allocate funding that goes to schools based and that it's none of us here currently are experts on that, but again, yes, we would be happy to connect you with more information on that, Sherry.
Patricia, do you want me to jump in really quickly?
Yes,
yeah, I think you answered that question really well. I mean, the SEEK formula is the funding formula driven that creates that allocation for the state to then decide how much money goes to per pupil in each local school district. And that funding could be used for transportation costs, books, it could go for special needs students. There's so much that is taken into account to that SEEK formula. And so the good thing that we've seen in the House and the governor's budget is that there's an increase to that formula. And so that way local districts can really utilize that flexible funding to do whatever they need for that school, for their schools, but also for their students as well. So hopefully that answers your question.
Great, thanks, Mahak. Great question from Phoenix. Where can I find out more information about PSAFE? I think that's for you, Courtney.
Yeah, so we can actually send you a one-pager, or if you go to the Kentucky Child Advocacy Center website, they have a one-pager that they've kind of broken down, like what their ask is, what type of medical services will be covered by whatever type of funding is allocated. And then I think they have like a specific dollar amount as well. And so it's broken out by the CACs, and then it also includes all of the rape crisis centers and then the domestic violence agencies as well. But I think the best place to start would be with either if you know your local CAC, or you can just go to Kentucky CAC website and pull the information there.
Awesome. And CAC stands for?
Child Advocacy Center.
Yeah. Okay, great. All right, thanks for those questions, you all. And now, before we wrap up, I wanted to share, so we couldn't do this week without the support of our sponsors and partners. And so we wanted to just give a quick message from our partners at United Healthcare.
Welcome, and thank you for taking time to participate in the important work of Kentucky Youth Advocates. My name is Krista Brinley-Hinsel, and I'm the United Healthcare Community Plan of Kentucky CEO. And I'm a mom of twins, so I can personally attest to the challenges of parenting. Keeping children safe and strengthening families are fundamental components of living a healthy life, and it's UHC's mission to help people live healthier lives. Kentucky Youth Advocates and United Healthcare began partnering in 2018 when we launched the inaugural Kids Count. Many local communities have leveraged the toolkit and collaborative funding to bring parenting programs to their counties. Foster care and youth needs are on the rise in Kentucky, and children in foster care tend to have greater physical and behavioral health needs than other children. Our goal with Kentucky Youth Advocates is to reduce the number of kids in foster care in each county by 25% before 2025, and to support the healthy development of kids throughout the Commonwealth. So thank you. Thank you for joining us today. Thank you for participating in the important work of supporting Kentucky's youth and their families.
All right. Thank you so much to everyone for joining us today. We're so glad you're here. So we hope that this provides you lots of information that you can use to take action and contact your legislators. So there's all the tools in the chat there. We'll show, you can find them all on our website. There's the bill tracker to keep up to date on the bills that are moving. There's fact sheets for all of the priorities that Alicia and Courtney shared today, and talking points. I should also say for our newbies, if you need to find out who your legislator is, there's a wonderful tool as well on our website that can help you find that out, and do contact them, let them hear from you, because we know children are the common ground when it comes to policies in Frankfort, that they're not left, right, Republican, Democrat. There are lots of common ground solutions for kids. And we have a better shot if all of us are speaking together to make the change that we need for our kids. So thank you for being part of that, and have a wonderful rest of your day.